Hi, Professor Maringhini. Thank you for accepting our invitation for a brief interview. The topic is imagination medicine behind the evidence-based medicine, a realistic approach for the gap between unmet needs of patients and limitation of medical knowledge.
You are a medical doctor and a scientist working daily on with the evidence-based medicine approach. Which is for you the unmet need for which imagination medicine is an answer?
Good morning. Thank you for your question. I'll try to answer introducing a few historical notes. Galileo Galilei, who was considered the father of modern medicine, modern science, introduced the scientific method in science in the middle of the 17th century. Astronomy, physics, chemistry were soon ruled by scientific method. Knowledge in medicine was limited at that time, and only 2 centuries later, thanks to new discoveries, the scientific method could be introduced in medicine as well. Medical practice has rapidly changed in the last 50 years. Many diagnostic and therapeutic procedures with no proved efficacy have been abandoned, phlebotomy, electroshock, etc. In order to avoid ineffective and dangerous therapeutic procedures, a new scientific approach has been proposed. The new methodology is called evidence-based medicine and was introduced 25 years ago. According to EBM, evidence-based medicine, only procedures and treatment that have shown validity and usefulness should be applied in medical practice. It was claimed that EBM would not replace clinical skills, clinical judgment, and clinical experience. As a matter of fact, systematic reviews, guidelines produced by doctors with no clinical experience guide clinicians in their practice. Physicians are now mere technicians who require and execute programs with only interest to follow rules established by committees. Cochrane is an example. A group of epidemiologists and statisticians review a limited percentage of scientific papers published in the literature, usually less than 5%, on a particular subject. Those review fulfill statistical criteria and most of the time conclude that more studies are needed. Sometimes recommendation by the Cochrane change in a few years. On the other hand, patients are now called clients or customers. And most of the times, physicians have to satisfy their request, which often do not coincide with treatment of their illness. The fear of patients' legal complaint refrains doctors to perform procedure or give therapy which have not been approved. Then defensive medicine is substituting good medical practice. In the past, a patient who was a sick person, allowing physician to do any attempts to treat his illness. Nowadays, a client is a sick person who demand effective treatment. Progress medical science risks to be stuck or delayed by EBM, evidence-based medicine. Imagination has been a clue to major development in science. Newton, Einstein, even Galileo have been driven by imagination in their discoveries, which have to wait time to be proved. Vaccination, blood transfusion, organ transplantation have been produced by what we call medical intuition. Of course, many theories have been accepted that have been accepted for a long time were wrong. Ambrose is an example of those. But I give you an example of imagination in medicine. Luigi Condorelli has been an eminent professor of medicine from Catania, where he kept a chair of clinical medicine before being appointed professor of medicine at the University of Rome. He was a cardiologist and founded the Italian Society of Cardiology. He thought that some forms of angina heart pain were due to coronary spasm, voluntary contraction of the arteries that provide blood nutrients to cardiac cells. The academic medicine of those days rejected this theory, since it was thought that angina was caused by a restriction of the arteries, as shown on autopsies. 20 years later, it was documented that, with the new diagnostic techniques, that Condorelli was right. In conclusion, I recommend medical students and young physicians to follow imagination-based medicine, besides evidence-based medicine they practice. And I suggest to read a book, Against Method, by Paul Feyerabend. Feyerabend was a professor of philosophy of science at Berkeley University in San Francisco. And in this book, the author claims that scientific progress is not due to the rigid system of rules commonly attributed to scientific method. Good luck.
Thank you for your answer. We understand and greatly appreciate your smart contribution. Have a nice day. Thank you.
Thank you.
You're welcome.
Thank you.
Bye-bye.